when I trim the molars under anesthesia, you have to trim the incisors. So what happens is that if you go in under anesthesia and you trim the molars several millimeters, if you don't trim the incisors, those molars are going to just grow right back, and you really haven't changed anything. So you have to trim the incisors the equivalent amount of millimeters to get those jaws closer up and actually to do anything, I guess, positive, to make any positive changes if the rabbit has just everything elongated. And so the other thing is that anytime I'm going to make changes in a rabbit's mouth and do the trims, it's usually going to be about 3 days. If I make major changes, it's usually going to be about 3 days after a major trim and major adjusting for that rabbit to want to eat on its own. So I'm always going to have the owners syringe feed that rabbit after the procedure, probably about 3-4 times a day, and do pain medication for probably about a week or two. Plus, a lot of times I'm doing antibiotics as well. Okay?
So after you trim the teeth, say, I think you mentioned something about the root being elongated,
Mm-hmm.
sticking out either this down or up.
Right.
Would that also fix that issue?
Nope. Once those roots are elongated, they're never going to be fixed. Yeah, that's not. She asked if when the roots are elongated down or up, if that would get fixed after a trim. And I said, no, that would never be reversed. Once those roots are bulging down or roots bulging up, you can't change that. Okay, thank you. Good questions. Yes?
If by root, I'm assuming that when you are looking at the front incisors, the root is the red, just like in the nail, a red colored part inside the tooth. Is that the root?
She's asking if we're talking about the root of the tooth, is that the red part in the middle, like in a nail? It's when I've been speaking about the root of the tooth, I've been talking about the bottom part of the actual tooth, as opposed to the kind of the top part of the tooth being the growing part in the mouth. When when you look at nails in a dog, cat, rabbit, there's the inside part, the quick, which is, I think, what you're kind of comparing teeth to. And so with the, there's I think you're thinking of the pulp.
Okay.
Yes, yeah. So when trimming incisors, then if you trim the lower incisors too short, you'll hit the pulp.
Right.
And then you really need to avoid that. So because if you hit that pulp and the pulp is exposed, it gets infected. And that can be very painful and damage the tooth. Okay? With the upper incisors, it's very difficult to hit that. So, but yeah. With the cheek teeth, the pulp is a lot shorter, deeper inside. So when we trim the cheek teeth, we really don't hit the pulp, the inside part. But with those lower incisors, that pulp comes out a lot higher.
Would you ever recommend taking out the lower incisors on a bunny and not the upper?
No.
Even in a case where, like this one, the lower ones grow every week,
Mm-hmm.
like almost a half an inch or more.
Right.
But the top ones grow slower and they're stronger, and she'll pick up her
Mm-hmm.
treats and eat them, and she can still bite them and chew them. And
Mm-hmm.
without those,
Well, if you were going to go under anesthesia, if you were going to take a rabbit under anesthesia, I guess I should repeat the question. I'll take a pause so you can cut here for the question, okay? The question was, in this rabbit, the rabbit has very abnormal lower incisors, but normal upper incisors. Should she have the lower incisors pulled, but not the upper incisors? So in answer to your question, if you're going to put the rabbit under anesthesia to pull her lower incisors, I would recommend pulling the upper incisors as well, and that way you don't have to worry about ever trimming her incisors. That would be my recommendation. Yes?
So I had a bunny for a little bit who basically fit the bill for every And so when he was, still very little, I had to get his incisors removed because it was too fast.
Hmm.
He did totally fine food-wise, but my question, what always made me feel terrible was what are some alternatives to stimulate them and amuse them when, most of what they do is chew toys or moving things around with their mouth. We had a hard time figuring out how to keep him, stimulated or from getting bored. Do you have recommendations of ways to like toys or games to give bunnies, who don't have their incisors anymore?
Good question. The question was how to stimulate a rabbit who does not have incisors to play with to grab toys. I guess probably encouraging him to bonk things with his nose, to push balloons, dig at things would be a good thing. Some bunnies really like to dig. But yeah, maybe to bonk things and move things around. Some of them, maybe he could still kind of grab things, a little bit. Some of the smaller things, lip things, yeah. So maybe some bunnies will, play chase. So those would be some things you could do. I mean, and then some bunnies, as they reach middle age and older, don't play much. But if he was still very playful, those would be some things. I've seen some bunnies that really like balloons. So that would be a good one, yeah. Or rolling things, yeah. Well, I think if they're just pushing them around, yeah, yeah, they just like to kind of chase them and bonk them. So, yeah. Any other questions? Yeah, sure.
Less of a question, but more of maybe you could explain a little bit to everybody. One other thing that I encountered was when he got jaw abscesses, the difference between a rabbit's abscess and what we
Mm.
see on a human or a dog. Or I didn't know that would impact how aggressive the surgery had to be, and I think it makes. I don't know if you could kind of like explain that to. That's what made it
Yes.
hard for me to know what it was.
Excellent point. Thank you very much for pointing that out.
I don't
No,
know,
no,
like,
no, I
tell you.
appreciate that. No, I appreciate that. Thank you. Yes. So the question was, or the comment was to please bring up the fact that rabbit pus is different than dog and cat pus. And thank you. I forgot to mention that. So rabbits are lacking the enzyme that breaks down pus. And so with a cat abscess, you lance it and the pus just pours out. It's real easy. But rabbit abscesses, their pus doesn't just ooze out. You have to physically remove it. And so that's another reason why rabbit abscesses are so hard to cure, is that the pus just sits there and you have to physically go in and take it out. The other thing also is that with the way rabbits heal is that they will encapsulate the infection with a very, very thick-walled capsule. And so that capsule will prevent blood flow from going in there and removing the pus, so that antibiotics and white blood cells just don't go in there and get it out. It just sits there. And so you have to physically remove it almost as if it is like a tumor type of a thing. And that's a lot of why we have to surgically remove these. There are some that will respond very well to antibiotics. But again, if there is a infected tooth root, it'll just come right back if you don't remove that tooth root. So you have to, when you have a rabbit with an abscess, you have to figure out, is there a tooth root involved, or is it like just a spike? Is it a soft tissue abscess? Is it a bony abscess? X-rays are very, very helpful. We have CT scans now that are much more affordable. So with all of that information, exam and imaging, we have to try to figure out what is going on and what's our best bet for treatment. So there are, with the CT scans, there's a couple of places to get those done, and the nice thing is that we've gotten so good at doing them that we can do them sedated. They don't have to be fully anesthetized. Any other questions? Okay. Thank you very much.